welcome everyone. I'm really glad you've hung in there and joined us for this webinar. I'm Donna Levin. I'm the National Director for the Network for Public Health Law. So during this session, this webinar, we're going to be focusing on the efforts we are seeing in legislatures across the states to roll back public health authority and the impact of these efforts. So this is really of great concern as we see a parade of pending bills and enacted laws that limits the authority necessary for day-to-day public health activities, as well as the authority to take measures necessary during public health emergencies. Next slide, please. So I'm really glad to be moderating this panel. That's me, and I will introduce our panelists now all at once so we can keep the conversation moving. Next slide. So first we will have, after I do a brief introduction on the topic, Andy Baker-White at the Association of State and Territorial Health Officers, where he is Senior Director for Health Law Policy, State and Territorial Health Officials. And then Katie Moran McCabe from the Center for Public Health Research at Temple University. And Dr. Nicole Alexander Scott is going to be able to join us at 2 Eastern Time. She has served both as the former Rhode Island Health Director and a previous president of ASTA. So next slide. Great. I'm going to start us off with a quick introduction to Act for Public Health. We are seeing an ongoing backlash against public health authority, and that has brought several leading public health law organizations together in the Act for Public Health initiative to focus on providing support and resources for our colleagues working to protect the public's health. So our law partners include Change Lab Solutions, Public Health Law Research at Temple, Public Health Law Center, Public Health Watch at Northeastern School of Law, University School of Law. And we're also working with APHA, ASTHO, NACHO, the Local Solution Support Center, and others in this coordinated effort. We are really standing ready to assist whenever and wherever needed across the public health landscape in order to meet the challenges we are witnessing to public health authority and infrastructure. Okay, next slide, please, Katie. So this is a bit of what we're doing in Act for Public Health. We have a listserv for about 1,500 at this point. We're reaching those in the public health field, practitioners and lawyers and agencies, advocacy groups, researchers, and others to share what is happening and offer resources and assistance, including what we're going to talk about today, legislative tracking, monitoring, sharing updates on judicial decisions, presentations, trainings on lobbying and advocacy, preemption, broader legal developments around strengthening legal authority and more, and real-time legal technical assistance. So you contact us and I will put I will put the contact information in the chat. And if you contact us, we will triage and we will get you the right person, the right organization to talk to. Next slide. So I just have a couple of slides on our efforts on the legislative front, and this is why we're here today. The network, Public Health Law Research, and ASO have been working closely to track the legislation of concern. And as part of this coordinated effort, the network has been publishing this 50-state legislative survey for bills pending and laws passed. So now it's current as of mid-May. It's in chart form, and I will put that link on the chat as well. It's got short summaries of the bills and laws and a table format that allows you to see quickly whether the bill shifts or limits authority and what public health measures are impacted. So the first slide here is a snapshot, if you advance it, Katie, thank you. A snapshot of bills as of mid-May. And you can see some of the areas of concern listed here. And unfortunately, some of the bills we've been tracking have been enacted. I don't think any of us would say that we have a perfect public health system in this nation. And there are several efforts underway to think about a better, more modern and coordinated future for public health. But laws passed in haste as part of a backlash are more informed by politics and science and expertise is not the way forward. Next slide, please, Katie. So you can see the tally on this slide and just a few words about the impact, and Andy and Katie will be adding to this as well as Dr. Alexander Scott. We see shifts in authority from public health agencies and the executive branch to the legislature, the state and local level, limiting what emergency orders can cover, and often that they need to be approved by the legislative branch at the state and local levels. And there are issues that arise with this shift. The legislature does not have the public health expertise that resides in the executive branch or in its executive branch agencies, health agencies. Legislatures don't move swiftly. Emergency measures must be decided on and implemented quickly. And when public health measures, including vaccination and mask requirements, and the ability to limit occupancy or operation of public places to protect the public's health is limited, public health agencies are hobbled in what they can do. So later this summer, Public Health Law Research at Temple will release comprehensive interactive maps and information on what we've been tracking. So Katie will be able to show you more about that. And I'm going to stop there and remind you to sign up for the Act for Public Health listserv, and we can keep you up to date on these resources and more. I'm going to go over to Andy, and since we didn't have our usual introduction, let me just ask you, please put your questions in the chat, because after Andy and Katie finish their presentations, we'll have probably a brief break till Dr. Alexander Scott joins us, and we will look for those questions. Thank you. Over to you, Andy.
All right, thank you, Donna, and thanks everyone for joining us this afternoon or morning, wherever you happen to be. This tracking of the legislation, kind of thinking back on it, it's something that we here at ASO started pretty early on. If you think back to March and April of 2020. It was an unprecedented time, of course, but every state, every territory had an emergency order related to COVID at the time, something that we've never seen before in public health. We were having those really fuzzy, warm and fuzzy commercials telling us that we're all in this together, and so forth. So we kind of felt like we were taking it on as one. That pretty quickly turned into challenges against the orders that we're seeing, as far as like the stay-at-home orders, the essential business orders, the business closure orders, and so forth. At the time, most of the legislatures, if not all, had really adjourned, kind of doing their part, either out of fear of COVID spreading, or just kind of as a social distancing measure. So we didn't see any sort of action in the spring of 2020 really aimed at what public health, what the governors were doing to address COVID. As we made it through the summer or spring and into the summer, we started seeing more and more legal challenges against the orders. And so it didn't take too much to start thinking ahead to the legislative sessions that we're going to be seeing in 2021, and thinking about what we might see as far as some of the things that were being brought up in courts kind of filtering over into legislatures as it came to public health authority. So for 2021 ASO, we've looked at public health authority, vaccine verification systems, or the passports, contact tracing, and vaccine mandates. So we did that throughout 2021 as a way to inform our members of what we were seeing happen in the state legislatures. In the fall and late fall of 2022, we got together with the network and Temple, Change Lab, and others, and we started together to focus on the 2022 legislative session. So I'm going to kind of briefly walk through those categories that we looked at for 2022, and then talk about some of the considerations, kind of just overall, for some of this legislation, where we might be headed, or kind of some of the concerns from just seeing some of the legislation that we've been tracking over the last couple of years. So if we can go to the next slide, please. So the first kind of category of bills that we've been tracking over this past year have been bills that relate to public health emergency orders. So these are either orders that are issued by state health officials, local health officials, or by the governor within the states. And for these type of bills, we looked at, we identified bills that put limitations on either one of these executive levels, the governor, the state health official, or local health official, to issue orders to address the public health emergency. So one is, again, the issuance. So some of the bills that we were seeing would require the state health official or the local health official maybe to get pre-approval before issuing any sort of order. Some of the bills would even require the governor to maybe give notice to the legislature before any sort of order was to be issued by the governor. So there's kind of the issuance category as far as public health orders. We also were identifying bills that dealt with the duration of those orders. You know, for example, it could have been a bill that reduced the number of days that a public health order could be in effect from 90 to 30. It could also, or, you know, even from, 30 to 15. The duration was also there were bills looking at duration around renewal or reissuance of the orders. So maybe saying that for any sort of reissuance, I had to have approval by the legislature, or that there could only be one order per kind of event, and kind of limiting things that way. We also were looking at bills and identifying bills that were limiting the scope of the public health emergency orders. So these were orders that were restricting the ability to prohibit business closures. So they're basically, kind of saying that the executive could not restrict customers to access, businesses. The scope issue was also looking at, we also were pulling bills that were looking at geographic scope. So there were bills that were saying that, an order could only be limited to areas that were affected by the communicable disease. And then finally, under the scope, we were seeing, especially in 2022, not so much in 2021, we're seeing bills that were limiting the impact or the effect that public health emergency orders could have on places of worship. So this was really kind of taking some of those Supreme Court decisions and orders that we were seeing in 2021 and kind of putting a carve out for places of worship within public health emergency orders. And then finally, we were seeing, as far as when it came to the issuance or limitations that were put on public health emergency orders, the termination of those orders. So we were seeing bills and proposals that were giving, perhaps the legislature the ability to come in and to, in some way, either through the legislature as a whole or through some sort of legislative committee, to terminate the public health order. We go to the next slide, please. Another thing that we're looking at, we're taking care to identify this past year, has been when we saw like a shifting of that public health authority. And some of the examples that we were seeing were proposals that maybe the shift that public health authority was going from the governor to the legislature, or from the state health official to the governor, or perhaps from a local health official to another entity of some sort. So next slide. We're also taking a look at bills that were impacting the use of pandemic-related public health measures. So these are the mitigation measures that were being used to help to prevent or control the spread of COVID. And so these were bills that were impacting isolation and quarantine. That was something that was a little surprising, that we were seeing legislatures looking at, kind of altering, such a basic public health activity and authority. Of course, we were also kind of keeping track of vaccinations. So bills that impacted the use of vaccinations or the authority to order vaccinations, venue restrictions, again, thinking back to the places of worship, testing, and mask. Next slide, please. And then a couple other categories that we're taking a look at as far as kind of limitations on public health authority. One was the application of federal law. So we noticed early on, and we decided to keep track of where we saw bills that were really attempts to limit the application of federal law or policy by directing state officials to not comply with federal COVID-19 vaccine policies. I don't think we saw too many of those, but it was kind of something that was a little striking to us that we decided that we should maybe monitor and keep track of. And then we also looked at preemption, and mostly when we were looking at preemption, it was we were turning our attention to limitations on local jurisdictions from exercising their public health authority or any sort of other pandemic response measure. And so one of the examples that we just here to highlight is a new Utah law. The bill actually passed that prohibits the local jurisdiction from applying an order of constraint against state-owned properties. Next slide, please. But it wasn't all doom and gloom. We were trying to kind of actually keep track of some of the positive aspects, maybe where we saw some expansion of public health authority. And so a few examples of note that we did see were new laws that authorized or gave the executive authority to expand scope of practice during disease outbreaks, or allowed out-of-state licensures, out-of-state licensed healthcare providers to come and work in the state during declared emergencies, and allowing for the administration of drugs and devices during emergencies. And then some bills around the public health data system. So of note was that there was a bill in Maryland that would have removed an exception for long-term care facilities when they submit vaccine data to the state's immunization information system. So that's kind of what we saw. And I guess kind of thinking about some of this authority, some of the challenges, it wasn't necessarily all red states that we were seeing kind of take some of these limitations. If you think back to the limitations of the public health orders, there was a bill that passed actually in Hawaii that put some limits on the governor's ability. So Hawaii, you have a Democratic legislature, a Democratic governor. So it wasn't necessarily, all of the things happening in red states or, and not in blue states. So I think, we'll be kind of, as we go forward, I don't know if we'll be seeing this as more of a legislative versus executive kind of push in some places, but, kind of things to, look forward to. This here is just a tweet that I noticed a couple weeks ago. As we think ahead to 2023, having some hope that, kind of as a lot of the politicization of COVID and of public health kind of maybe starts to die down, that some of these attempts and proposals will kind of start to go away. But just noted this tweet out of Michigan, this group looking to, keep using the legislature as a way to restrict pandemic orders by health officials. So I think it will probably still be an issue in 2023, but just hoping not as, we won't be as busy in identifying hundreds of bills, but maybe dozens instead. I think that would be something to look forward to. So then I think I have one more slide. I just want to kind of touch base on some of the kind of future considerations as we move forward with this new legislation and the impact that it might be having on public health. You know, one of the concerns is that this type of legislation that we've been seeing, you know, through the proposals and through the enactments, will have a chilling effect on public health responses, and you know, cause our public health leaders to worry about whether they're taking action to address some you know, non-COVID public health emergency could perhaps lead to some sort of legislative retribution later on. So, you know, we're going to be trying to kind of follow that, figure that out. Is that having an impact on the activities of our public health leaders in the states? I think one of the things is, you know, as we move forward, just a real need to re-educate and maybe even just educate the public and our policymakers about public health actions and the role that public health plays. Something to think about that we saw kind of come up during COVID is the enforcement of public health measures. If enforcement is left to maybe local sheriffs or the state attorney general, and you know, if they're not going to do the enforcement, then what's the use of having an order? So that's kind of something to think about, is, you know, the future enforcement of public health orders. Making the importance of public health known. So kind of similar to re-educating the public, but letting the decision makers, the policy makers kind of know what the purpose of public health is, kind of doing that inoculation of them beforehand. We can let them know why public health collects data, why public health monitors disease, why we have case reports and so forth beforehand, before a constituent comes and says, I don't want the government having my information. You know, this can maybe help that policymaker understand why those rules are there, why those laws are there, and think, well, okay, I've heard about this. I see why they are doing it, and maybe kind of prevent them or kind of keep them from, you know, trying to limit public health authority in different areas. Another area that we're going to, you know, for the future to think about is public health's use of rulemaking to maybe temper some of this broad legislation. Maybe so looking at how, you know, what the law's intent is. And I think those who are friends of public health can support those rulemaking, that rulemaking through public comments. You can also kind of help with the proposals in the legislature through comments on the bills, attending committee hearings and so forth. And then the final kind of future consideration, I think, is how are these bills that have been passed, and then those bills that are going to be proposed in the future, how do they impact the state-local relationship in responding to public health emergencies? So I think I will leave it there and pass it over to Katie. Thank you.
Okay, thanks, Andy and Donna. Hi, everyone. I'm Katie Moran McCabe with the Center for Public Health Law Research at Temple University's Beasley School of Law, and happy to have the chance to talk a little bit about our collaborative legislative tracking project. So thank you all for joining. Okay. So as Donna and Andy mentioned, as part of the Act for Public Health initiative, our center, along with the network and ASTO and Local Solution Support Center, are working together to track legislation addressing public health authority and to create resources to be able to easily see the legal landscape on this issue across the United States and see how it's changing. So Andy just gave you a sense of the types of legislation that we're tracking. And now I'm going to talk a little bit about the resources that we're creating with all of this information. So first, I just wanted to give you sort of a high-level overview of our process, which you can see on this slide. So basically, ASTO and the network are sharing the bills that their organizations are tracking. And then we at the center are merging the bills as needed and organizing them so that they can be imported into the Monocle software that we're using, which I'll talk about in just a minute. And then using that spreadsheet, a data set record is created for each entry, for each bill. And then we are adding the text of the bills to those records in Monocle, and also adding citations so that users can see the actual legal text that's associated with each element of the bill that we're tracking. And then the result is the creation of 7 legal data sets tracking this legislation, which I'll explain in more detail in just a minute. So first, I just wanted to just say a few words about the Monocle software that I mentioned. So Monocle is our in-house software platform that we use at the center to create legal data sets. So it allows users to navigate and organize complex legal text and to produce legal data. So it's using Monocle, it's very easy to organize your research, which is really helpful. Tracking legislation across all 50 states and DC can involve, as particularly we're seeing in this project, can involve a lot of bills and or laws. So it's really helpful to be able to have all of that information in one place and be able to easily organize by jurisdiction and time period. Monocle also allows users to track changes in laws over time. So it's really easy to amend the text of the bill to reflect any changes in legislation. Also with Monocle, users can easily collaborate on projects. So multiple people can be working on the same project at the same time, which is really useful. And then finally, it's very easy to share work with others through Monocle. So it allows for quick and easy publication of data sets, including maps and tables. I'll show you some examples of those in just a minute. And Monocle also converts the text of the law for the elements that we're, or bills that we're capturing. It converts the text into numerical data, which is then available for download in an Excel spreadsheet. And that facilitates the use of legal data for evaluation and for analyzing impacts of legislation. So it's a really useful tool. Feel free to follow up with me at any point if anyone is interested in learning more about this. Okay. So these are the 7 data sets that we are creating. We have 6 that cover the topics that Andy just talked about. Plus, we also are creating a summary data set that will give a high-level overview of which types of bills each state has. So all of these data sets cover all 50 states and DC. And they are still a work in progress. I do have some preliminary maps to show you, but we are still working on all of these. Okay, so this is just an example of part of what you'll see when you go to the homepage for each data set. So this is a preview of part of the page for the preemption data set. So on the left-hand side, you can see there are questions and potential responses that capture the elements of the bills that we're tracking. So for each data set and each topic, we're capturing information about the bill. So the bill number, when the bill was introduced, the status of the bill, things like that. And then we also have one or more questions about the subject of each data set. So you can see those questions on the left. And then on the right-hand side, you can see the map showing the results of your queries. So the data sets, you can query those by variable. So you can select a response on the left side for any of the questions and then see which jurisdictions meet that criteria in the map on the right. And in the map here, the states in yellow are states that only have one bill that corresponds to the variable that's being queried. And then the purple states have multiple bills that correspond to the variable. Also, these data sets will be longitudinal, so they will capture changes in the legal landscape over time. So whether it's a change in the status of a bill, so if it went from being introduced to having passed, the first chamber, all the way through to, if it was enacted. So we'll capture those changes as well as any new bills that have been introduced. And that's what that yellow timeline at the top left is for. So you can use that timeline to select a particular date and then see how the map and the responses to the questions that you've selected change based on that date. And then you can also query by jurisdiction. So you can click on any state on the map and see what the responses are for all of the questions for that state. So I'll show you what that looks like here. So this is an example. If you were to click on, just one state on the map, you'll see a profile card that will appear and will have the responses for all of the questions for that state. And if there's more than one bill, you'll see multiple, a profile card for each bill in that state. Okay. And then in addition to the data appearing in a map, there's also a table for each data set that shows up just underneath the map. So this is a snapshot of part of the table for the preemption data set. So you can see, you can select as many variables as you'd like. Again, from that left-hand side on the previous slide that had the questions. And then the states that meet those criteria, and again, in addition to showing up on the map, will show up in this table just underneath it. And then for each jurisdiction that meets the criteria, you'll see in the table the variable itself, as well as you can see those yellow section symbols, which link to the citation for each response. So if you click on one of those yellow symbols, this is what you'll see. So you'll get a pop-up, a citation box will appear with the citation and the excerpt from the bill that supports the coded response. And then you'll see within that excerpt box, there's also a double section symbol on the right-hand side. And if you click on that, the full text of the bill appears. It looks like this. So here you can see, clicking on the double section symbol there, you've got the specific excerpt on the left-hand side, and then the full text of the bill will appear on the right. Okay, so there's another view on each dataset homepage that allows you to query by question and then to see the response for all states at once. So you can really get a good sense of the landscape throughout the whole country in one shot. So this is a screenshot of that view from the data set on federal law limits. So it's showing which states have a bill that would attempt to limit the application of a federal law related to public health emergency. So there are 7 states that do. Again, the states in purple are those with multiple bills. The states in the dark yellow have just 1 bill that meets that criteria. And then the 44 jurisdictions in light yellow do not have any such bills. The data you see here is as of April 15th, 2022. It includes bills introduced from January 1st, 2022 through April 15th, with just a few from 2021. So we are, as I said, this is a work in progress. We are still adding all of the 2021 bills. We started with this year to try to track the current movement first. So again, just a caveat that this is a work in progress. We still have to finish getting the 2021 bills in. We are also updating, we're in the process of updating the data sets through May 20th, 2022, and doing some quality control. So we are, we will plan to release those soon, but in the meantime, these are just some preliminary numbers. I wanted to give you a sense of what these maps and resources will look like. So I'll show you a few more quickly. So this is the data set capturing shifts in public health authority. So currently showing 16 states that have a bill shifting authority. And this is the preemption data set showing 19 states that have a bill involving the preemption of a public health emergency measure. And then finally, as Andy mentioned, there are some bright spots that we're tracking. So currently 17 states with 1 or more bills that would expand public health authority. Okay, and I just wanted to switch gears slightly and quickly show a related data set that's already published on lawatlas.org. It's part of the Center's Sentinel Surveillance of Emerging Laws and Policies project. And this data set is similar to the one that we're creating on bills that limit public health authority related to emergency orders, but this data set tracks laws that have been enacted. So it also covers the 50 states and DC, and just gives a high-level overview of laws that limit the authority of a governor or a state health official regarding emergency orders. So this includes laws enacted since January 1st, 2021 that were effective on or before November 5th, 2021. Okay, and this is just a screenshot of the 19 states that had a law limiting state executive authority related to public health emergency orders, again, as of November 5th. You can find the data and explore the maps on lawatlas.org. And we are in the process of updating this now. So stay tuned, that updated data set will be published soon. And this chart just shows the progression of the states that enacted laws limiting authority around public health emergency orders between January and November. You can see most of the movement there between February and August. And we will be updating this chart as well with the update of the data. So stay tuned for that. Okay, I will stop there. My contact information is here, so please don't hesitate. I think we'll have some time for questions now, but don't hesitate to follow up also with any questions. So thank you so much. And I think I'll turn it back to Donna to see if we have any questions.
Great, thanks. Thanks, Katie, and thanks, Andy. So we have a few questions that came in. I might start with the last one from Heidi Wheeler to you, Katie, that can we put the link to the map in the charts? I didn't know some of them are still internal, right? Maybe the last one is possible.
Yep, I can share. I'll put the link to that last data set in the chat, and then hopefully, yeah, soon, shortly, we will be able to share those other links. But for now, I'll throw
Right.
the link.
And then the first question that came in, well, we had from Amber said that a future consideration should include preemptive gun laws. For example, Oklahoma is the only state with an anti-red flag law. So that might be something that Law Atlas looks at the future. In the future, I also mentioned in the chat the Local Solution Support Center, which is laser focused on preemption.
Yeah.
Andy.
Yeah, Donna, similar to some of the bills that we're seeing as far as the around free exercise, basically, they were carving out exceptions. There were also bills kind of carving out exceptions for based on like Second Amendment rights as well. So saying that gun shops can't be closed during a public health emergency and so forth. So, those two, I guess, constitutional rights we're kind of seeing highlighted in the legislation over the past couple of years, and kind of carve outs for those. So yeah, interesting topic. And I think a few weeks ago I was kind of putting together a timeline for our members as we did an after action review on the COVID response and kind of the use of public health authority early on. And I was trying to take a look at kind of what were some of the first legal challenges to the use of public health authority. And I think it was sometime in March, there was the governor in California was sued by a gun shop for the business closure. So yeah, kind of an issue that we're seeing, as it relates to public health authority.
Right, and I've just been reviewing the laws again, and there a few of them have passed with special exemptions for not only the bills but in the laws. Yeah. Then we had a question: what pressures, lawsuits have you seen regarding public health legal teams challenging these political restrictions limiting local health authority or local health agency power? We have been part of the Act for Public Health effort has been Public Health Law Watch, and those updates are going out on the listserv. Most of those cases, if I'm not wrong, and Andy, Katie, correct me, are more state focused. I think it's harder to track some of the local public authority, but I think if you sign up for the listserv, and I will put my email in there, and I'm happy to send. I think it was let's see who asked that. Stephanie Walker. If Stephanie, I'm happy to send you all the work done so far, and also put you in touch with the people at Public Health Law Watch at Northeastern. I'm sure they'd be glad to talk to you about that, but I can't give you chapter and verse on that now.
Yeah, kind of like the type of lawsuit I think that we've seen most around has been where the state has limited like either the local health authority or more often like a school from instituting a mask requirement for the students. And then we've seen several federal cases or cases filed in federal court by disability advocates or parents with children with disabilities challenge those prohibitions of having a mask requirement. It's the one that kind of comes to my mind. There may be others, but
yeah. Let's see. I think we had another question. Is the view, just for UK, the view of data sets only available to registered partners, or is it public?
So they are not public yet, but they will be as soon as those data sets are complete and published. They will be available, I believe, on the Law Atlas website as well as the Act for Public Health website. But they will be freely and publicly accessible.
Right, and at Law Atlas right now, if you go to that website, there are other databases that might be of interest to people that are, it's all public, the ones that
Yeah.
you publish, right?
That's right. Thanks, Anna. And I'll put the general Law Atlas website in the chat so folks can explore the other topics if interested.
Yeah. Great. I don't see, let me see the 4 new messages. Hold on.
Well, Donna, there's a question asking if we're tracking state legislatures' action to limit medical board actions against physicians and pharmacists in the professional capacities and off-label treatments with discredited COVID therapies. I think that has been something we've discussed as a group. We might, Katie, I think we put that under kind of an other section at this point. But I know it has been something that we've noticed.
Yeah.
Yeah.
I think in our survey where we've noticed that, we've put it in other. So ivermectin and what's the other one I always blank on, probably on purpose. Yeah, we've seen a couple of bills like that. I don't know, when I was looking over the laws as of mid-May, I don't know if I saw any of those had passed. I'm not positive, but yeah. So I guess not religiously, we're not tracking them, but when we see them, we're noting that.
Yeah, very, very interesting type of bill to see.
Yeah. Let's see. And Stephanie seemed we had dueling banjos in Texas during the COVID response. Governor with emergency powers, which he thought were exclusively his, public health with those powers, and lots of conflict. But locally, we didn't have anyone go to court to implement any order, and none going to court to challenge any that I'm aware of locally. Yeah. All right. And Sadia, will you let us know when Dr. Nicole Alexander Scott has joined us? I hope that would be great. Great.
And Donna, I guess just kind of real quick.
Yeah.
With Stephanie, her comment about what was going on in Texas, that has been something that we've kind of heard of. The kind of the fusion of public health authority and the ability to respond to the disease outbreak, not just between state public health and local public health, but finding out what authority the schools had, school districts and so forth. And so I think in some places there was kind of this, maybe not unwillingness, but kind of not, I'm not taking the authority, I'm not going to take the action, are you going to take the action? Because I'm not going to take this sort of action. So I think that, I think in a lot of places we'll look back and we'll see where there was kind of that disconnect between who had the authority and maybe a willingness to act or an unwillingness to act. And that's why in one of the considerations that I highlighted, just, for these future bills, the future laws, kind of one of the things to think about is how would it impact the relationship between states, locals. You can add in there, I guess, school districts, other entities that have some sort of authority to, intervene in this sort of outbreak.
Right. And on that note, I can put just add a shout out to in the past, the CDC had given the states 2 rounds of funding to try and take a look at public health authority in advance, right? Public preparedness for emergencies, and have the states take a look at what authority they have, where they overlapped, where they contradicted, and do an actual tabletop. And we're working on, ASTHO is working and Network is helping on another, the latest iteration of that. And we've learned a lot now in COVID. And so this, the different layers of authority and contradictions, et cetera, you have to try to iron those out, work those out in advance. And then also we're finding build the trust right in advance and the relationship with other sectors, be it business or enforcement, and have the biggest people, the biggest amount of people, largest amount of people you can have at the table that are impacted. So I think that resource, when it comes out, will be very, very helpful on this score. And I think I see Dr. Nicole Alexander. Yes.
Hello.
So hello, we see your beautiful sunset picture.
But not my face. That's odd.
Not your face, no. But yeah, so we've just been pausing to do some Q&A and are looking forward to hearing from you, an actual practicing practitioner in a state public health agency when all this was going down.
Absolutely. I will, in the meanwhile, attempt to understand why the video is not showing me, but want to make sure we keep going and really talk about, and I look forward to questions and input on how challenging it can be to have the type of questions arise regarding our public health authority. There are 3 different areas, I would say, that has the type of concerns that exist when public health authority is challenged. I'm not sure why the video isn't showing. So if anyone has suggestions, feel free to let me know. One is the ability to actually do the behind the scenes, the administrative work that exists. If there is some tightening or restriction to our public health authority, oftentimes people don't think about the impact on finance, other administrative and legal activities that are needed to carry out. How do we obtain the PPE that's needed? How do we quickly set up the testing sites and vaccination sites that we need to be able to put in place? How do we leverage the authority to ensure that quarantining is occurring with having the proper legal team and administrative support to effectuate it? Our dependence on the National Guard, for example, was something that we've never experienced before. And when there are restrictions in place, not only does it impact the policies, but it also impacts our ability to implement those policies as effectively as we need to. Another place where it really took effect was our ability to actively advance the public health need for providing the health and safety goals that are naturally in place. So we had the battle with our vaccine mandate, for example, and knowing that the Rhode Island example that we have as a very tenuous healthcare system and inability to really have any leeway if we were to have some sort of devastating impact to our healthcare workforce. And so the ability to move towards requiring vaccination was not only just, for the safety of the patients, but it was to ensure that we had some form of a workforce in place to be able to carry out the healthcare needs. We have one or two major healthcare systems and other very small healthcare systems, and that's it throughout the state, all interdependent on each other. There was not significant bandwidth or alternative to go with. So without having the ability to work with those healthcare systems directly, many of whom early on were begging us and asking to partner with us to require vaccines so that they could preserve their workforce, and willing to go through what was needed, we certainly had to ensure that we could enforce it effectively. Without that ability and the authority to do so, there could have been significantly more devastating impacts on our state, essentially, and ability to save others. And so, lastly, that obviously plays out in the need to respond quickly in such a dynamic pandemic atmosphere or environment. It changes constantly. We all experienced that, and the flexibility that's necessary in order for us to be effective can have devastating impacts if that is restricted in terms of the public health authority that exists or that is needed for us to function. And so, our early on 7-day-a-week press conferences literally talked about what changes we were making on a 24/7 hour basis. And that was with the ability to have that authority early on. I definitely acknowledge that if we had the type of restrictions and limitations to that we had later on in the pandemic, going into 2021, after people began to express their concerns more and get tired of the pandemic and all the things that we experienced, we would have, if those restrictions were in place early on, we would have lost significantly more lives, and there would have been exponentially more morbidity along with that mortality in place. So those are the three areas that I would share on the front lines are critical examples of why it is a life-saving measure to ensure that we have the type of public health authority and flexibility that's needed in order for us to be effective in responding and doing what's needed to save as many lives as possible and keep as many people out of the hospital as possible. I will pause there and see if I can continue to figure this out while we see what other questions may exist.
I wonder, sometimes I have my camera, the little, at least on my computer, the little thing at the top, goes back and forth. Sometimes it blocks the camera on purpose.
Okay. Right.
So you can move that. I'd love to see you, but
I know. I'd love to be seen.
we missed the beginning. We have had some like ghosts in the machine here, so you're not alone.
Okay.
All right. Well, we welcome any more questions. Certainly based on what you've heard today, or what Dr. Nicole Alexander Scott has been talking about. I can see some in the Q&A, which is different from the chat. Um, how are state legislatures able to supersede a federal law? Doesn't federal law override state or local laws? I would say yes, federal law does override state or local laws. It's interesting. So one example of a law that passed that basically said, I'm not sure which state, we will not enforce CMS or OSHA requirements, I think, with respect to vaccination. So all I can say is what I understand of the law, if that were challenged, that would fail. Especially because there's money tied to following those regulations. Anything else you want to add on that, Andy or Katie, on that score? No. And do we track the limiting of non-emergency public health regulations or orders? We're not down that far, really, right? That would be as like daunting as the 1,400 or so bills that we were tracking. We haven't been tracking every order or regulatory response. Andy, did you want to add? You're on mute right now.
No, but it was making me think back to the Avali outbreak from a few years ago, and there were a few states that issued emergency rulemaking to prohibit, I think, flavored vaping liquids. And so I think, I'm not sure if I can think of any state that wasn't, where it wasn't challenged, those emergency rules. But nothing kind of consistently as far as just other non public health rulemaking or orders that we're following at this time.
And then can we say a few words about the partisanship behind initiation and support for the different types of legislation?
So, I mean, it's been really interesting. I mean, you think about, you know, there was a lot of controversy in Michigan, which had a Democratic governor and a Republican legislature, and same divide in Kentucky. And there were court challenges and shifts in public health authority in Kentucky as well. But then in between Michigan and Kentucky is Ohio, which had a Republican governor and a Republican legislature. And there were probably even larger shifts in authority in Ohio. And then again, I mentioned Hawaii, which with a Democratic governor and a Democratic legislature. So it's kind of been all over in some ways. I've heard this from some of our peer groups here at ASTO, is kind of how can we look at the bills that didn't pass and kind of tell why they didn't pass. That's kind of something I think we can maybe look into. You know, I'm not really, I haven't thought of a way to quite do that yet. But just, you know, anecdotally, I've heard from one state, heard about it in one state where there was a bill that, you know, kind of knowing the composition of that state, this bill limiting public health authorities should have passed. I, you know, was surprised that it didn't. And then learned that, you know, one of the things that happened was that the legislators were really informed about what that bill would mean to them, and what it would have meant was more work for them. And so that, at least in that state, you know, caused, you know, oh, you know, so they didn't pass the legislation. Yeah, I'm not really sure. I think one thing is, I know we're keeping track of things that have passed, but it can be helpful to kind of keep track of what hasn't passed, for when that type of bill comes up in another state, and it can be pointed to like, oh, that's been tried over here 10 times and never passed, and that can help dampen some of that. Right.
Yeah, and although we can't take credit for a certain law not passing in Utah that had to do with, I think, vaccination as a protected class, in terms of discrimination, being unvaccinated, we certainly were able to add resources, make connections to other people who had fought those bills, similar bills in other states. So, that is a possibility, and that's something that Act for Public Health can help you with. So seeing those other examples and what has helped either defeat or pass a law in the past. In terms of, is there any scoring of how likely introduced legislation is to pass? There are many bills introduced annually that have no chance of passing, overriding a veto. Justin Shang asked that. We have talked about that, because if you're very close to a state, you may know that perhaps someone in the legislature advances a bill, puts a bill in that has, usually anything that person does is not given much traction. So, why are we following things like, it's just hard to know. It's just very hard to know. So I don't know, Andy or Katie, whether you have any take on that.
I've heard both sides. I've heard from some of our members saying, why track so many that don't even get any traction? They're just introduced, and they're maybe posturing bills or, red meat type of bills. But then I've also heard from folks that we that we help here at ASTO say, no, we want to know about those, because we want to know what is being proposed, and if it's something that's could have a big impact, then we want to know it, even if it's not getting traction right now. So I don't know, it's something I don't have a good answer for it right now, because like I said, we're kind of going back and forth. Do we track everything? Do we not? Do we report on everything? Do we not? So we're hearing both right now. So I think we'll probably just try to keep track of everything right now and let people know as best we can.
Yeah, and I think we're in this collaborative, we're learning as we go too. So we're learning as we go, and we're learning from everyone out there in the field, on the front lines, what's helpful, what's not. So we'll be correcting accordingly. So this question from Rachel Cohen might be to Dr. Alexander Scott, but Rachel does say, practicing in a conservative state, it seems like more educated legislators are about public health, the less public health authority they want public health to have. Any thoughts on the sometimes unfortunately counterproductive consequences of more people understanding what public health authority even is? I wonder, Doctor, if you have a take on that, a response. Oh, there you are.
I have to improvise. So, yeah, that's an interesting thought. I'd welcome other input. My general feeling is, with proper education and further receptivity to the necessary information and knowledge that exists, that type of enlightenment leads to better decision making, and then at least an understanding of the impact on that individual's personal family members, constituents, whatever, helps them better understand why it's important to them. But certainly can ask the question further or share more about how else to navigate it in a conservative environment, which certainly is increasingly a challenge all to itself.
Right. I can just say that Act for Public Health has held a couple of town halls, and all the thinking as we think about how to do this better, how to strengthen public health going forward. A lot comes up about messaging and how that is really center and key, even to what lawyers do, how to message the importance of day-to-day public health, what it is, and then the importance of having the authority when you need it. And then we have the whole other aspect of trust, building that trust so that we don't have the kind of conflict and way that mis and disinformation can take hold that we've had the past couple of years. Welcome any other thoughts on that?
Yeah, so Donna, back on my slide where I had kind of some of the future considerations, and I had the mention of kind of the inoculating policymakers, kind of almost like a pre-bunking. So, letting them know what public health does, the purpose of these authorities, purpose of these public health activities up front can, perhaps help later on if they do get that question about, the example I was trying to use was around collection of public health data, why we do it, what purpose it serves, so that when they do hear from a constituent about, I don't like the health department having my information, then they already have a mindset or a framework for understanding why the information is being collected. That suggestion, that kind of type of action, came from a legislative liaison in a conservative state, and and he said that's how they've approached legislators in their state, is talking to them about what public health does, and giving them that mindset, that framework ahead of time, so that when they do get the criticism, they kind of it's tempered. It can be tempered. I'm sure it's not going to work for everyone, but that's just one of the things that we've heard.
Right. I mean, we've also heard and been thinking about how that line between advocacy and lobbying and health departments at all levels are very wary in that regard. And there are some health departments who aren't, quote unquote, allowed to get anywhere near advocacy, but building those relationships in advance in times of peace and quiet, when it has to do with less controversial issues, is just worth its weight in gold, I think, exactly for the reasons that you're saying. I know when I was general counsel and for the Department of Public Health in Massachusetts, there was definitely concerted effort by commissioner after commissioner to do that, including giving awards to public health as supportive legislators. Let's see, do we have any other questions?
Donna, there's one that was asked in both the Q&A and the chat.
Oh, great.
So I want to get to that one.
Good.
But it's asking about regarding the legislative data, who submits the information to the various databases. So my team here at ASTO is collecting the data that Katie's team is then reviewing and adding to the data set there. But I also know Donna's team at the network is collecting data as well as kind of filtering all through Katie's team. Katie, I hope I set that out correctly. You could probably do a better job than I can to explain how we're getting this information.
Yeah, no, I mean, I think that's exactly right. So basically, asked Andy and his colleagues at ASTO, as well as Donna and folks at the network are tracking these bills and this legislation, and then we're sort of merging it, putting everything together, and using that to create the data sets, that will soon be available in map and table form.
And how we're doing it here at ASTO is we use a service called Fiscal Note, where we've set up search terms. We get discovery alerts, and then we review the bills that our search terms have collected and identify those that are relevant to our purpose. And then we collect those and pass those on to Katie's team.
Right. And I think there are different data sets, Legiscan, and, we've searched in different places, which has been great because then Katie and her colleagues get our information, at least early on. We were doing it that way, our information, ASTO's information, seeing where the twain met, where they didn't. So it became a better data source that way, I think. Let's see, anything else? Let's see. Rural, let's see, Jennifer is saying there's a legitimate distrust of health systems because rural health systems generally are not very good in terms of care. Trust is not built top down here, only from neighbor to neighbor. That has come up as well as we're learning about communication and talking about, another big part of trust is communication, relationship building. And then if we're doing the relationship building right and robustly, then we should be able to make headway with communication because we should be able to be building trusted messengers in the community, right? So there should be constituents, people who can carry that message for us and work with us in partnership, and who we, public health practitioners, program people, lawyers, are listening to from the ground up. Doctor, anything that you've experienced there?
Yes, very much so. There are two aspects to the communication piece. One is...
Whoops, you're going a little in and out.
Am I?
Now it's good.
Okay. There are two aspects to the communication piece. One is being able to speak plainly and in a language that people can understand. I often say not speak in public health legalese, which we are familiar with and many members of the public are not. We were all fully tested in that with, those of us that were blessed with participating in the 7-day-a-week press conferences to have to really relay the information effectively to the public. The other aspect of communication that I think public health can also improve on is the ability to make clear the message according to the audience. The example I've often given is the argument was often stated was public health against the economy, throughout the pandemic response. And I would have to catch myself or just express the reminder that the aspects of the economy are an important part of public health. They are one and the same. How can we better communicate with those in commerce, with elected officials, with housing development folks and planners, and so many that legal, finance, inside and outside of government? Public health touches on all of it, but we are often like in this separate world and need to do a better job integrating and figuring out how to speak the language of those others, so that when it comes time to justify important authorities and decisions that are made for the greater public, there's more of an appreciation for, you know, who these folks are coming from public health. So many people just got introduced to public health for the first time. And yet, as I used to have in my signature line, public health saves your life every day. So figuring out how to really integrate that more intentionally, and during these in-between times, as stated, go meet with the Chamber of Commerce and, you know, all the other non-traditional players. The few times that we attempted it, we had folks really like looking at us cross-eyed, like, what do you have to do with us? And we could see that there was a lot to overcome. And that's a huge part of the communication early on, so that when these massive things happen, we're not just totally starting from scratch.
Right, right. Wow. Yep. I know we have a couple of questions we have not answered. I want to make sure to thank our speakers here. And I'm hoping, Sadia, can you make sure to copy the chat and the questions, and we will get back on the ones that haven't been answered?
Yes. Yeah.
Great. All right. There's like 1 minute. We don't have a federal, I don't think we have a federal legislative agenda for Act for Public Health. There are lots of players in the mix doing that now, and that may be something we come to at a later date. And then there was just one more question, stick and carrot. Yeah, I do think, you know, as always, you can use federal law to, you know, whether it's enforced or not, to tie money to certain right actions, and using the federal purse strings that way. So anything else before we leave? I know it's 2:30. I really appreciate our speakers, our audience. I implore you, reach out to us. We're here for you. And Andy, anything else in parting? Katie, Dr. Nicole? Nope. And thank you, Sadia.